Welcome to Thursday Thought Leaders with Harvinder Narula on BW Healthcare World. Our guest in today's edition is Dr. Suhatesh Bastia. He's the co-founder of Alleviate Pain Clinic. Now, with a passion to enhance the quality of life through innovative approaches, Dr. Bastia established the Alleviate Pain Clinic to provide relief and healing. Let's speak to Dr. Bastia on BW Healthcare World today. So welcome to BW Healthcare World, Dr. Bastia. It is such a pleasure to have you with us today.
It is all fine, sir.
Dr. Bastia, when you started Alleviate, what was the motivation behind it to pursue a career in pain management rather than focusing just on orthopedics, which is what you're formally trained in?
So to answer that, it dates back to my experience in London, where I was pursuing a fellowship in trauma and plasty, and I saw a lot of people benefiting with services at chronic pain clinics with interventional pain management and regenerative medicine treatments. And I would say I always had a little contrarian bent right from the beginning. So I was always looking for those things that are still in the evolution or the developing fields, even in musculoskeletal. So PRP, which is platelet-rich plasma, is something that was introduced to me 20 years back by one of my professors. He told me that this is going to be the future of musculoskeletal medicine. I mean, there was a time where people were saying, I mean, what is he saying? How is this going to help? And now I see along the years, how regenerative medicine and pain management has progressed. So what we realized that in India, when we saw the whole landscape of chronic pain management, we found it to be very fragmented and punctuated with just single doctor-led practices. So we wanted to establish a brand in chronic pain management, which would, so that people knew, so the people who are in chronic pain know that other than hospitals, also the traditional hospital treatments, there are pain clinics where they can go, get assessed, get diagnosed. And if possible, there are a lot of treatment options available to people. The main idea is that because I'm from orthopedics, I do realize that out of chronic pain patients, out of 100 patients, maybe 15 to 20 need surgery. So these are the indicated cases for surgery, which should undergo surgery, for the best results. But then there's a chunk of 80% of chronic pain sufferers who are either not candidates for surgery or who are not medically fit for surgery, or who point blank, like many people in our families also, don't want to go under the knife. So what do we do for them? So there were not many treatment options available to them. A lot of people, were advised surgeries at an early age also. I've seen, in terms of chronic degenerative conditions. Plus, they always, so there is a always thought process in a person's mind. Then what is the, if there is anything other than surgery that is available, for my problem. So that is where I thought that, we could go deep into interventional pain management and regenerative medicine. And because the scope of work is from head to toe, there's chronic pain in so many things, from musculoskeletal conditions like knees, shoulders, backs, neck, spine, to myofascial pains, cancer pains, and so on. So that was the main thought process, behind that. So that has been the journey in, spreading the awareness about chronic pain in amongst the people and the fraternity, and developing a patient-centric approach towards the same.
And Dr. Bastia, pain management is relatively a new field, compared to when we compare it to traditional surgeries or treatment options. What are some of the challenges that you may have faced while establishing the practice of pain management in India? Did you face some pushback from surgery departments and the industry, and also maybe the acceptance of pain management as a treatment option by the patients itself? What have been some of the challenges that you have faced?
So as you all, rightly said, the biggest challenge was lack of awareness when we started off. So when we started off, say 5.5, 6 years back, there was hardly any awareness about pain management. And on a funny note, when we started, some people thought that maybe this is a new spa place or a massage place. What is this pain management? So from those days, I can proudly say that we have been able to build awareness regarding the same amongst people, as well as through the medical fraternity. Even the fraternities, 70 to 80% of the fraternity thought that pain management is some blocks and injections. That was the idea. So no one knew beyond that. So we did spend time and effort in conducting workshops, seminars, education programs for our peers as well, because we wanted to tell them, as in, what we are doing. So the point where, like you said, orthopedic surgeons were not very happy that someone else has come treating the knees and the spines and in the necks. Now they understand what we do, and people who understand the correct indications. If there's an indication for an image guided treatment, the patient should be channeled towards that treatment. If there is an indication for surgery, I myself will tell the person that a surgery would be the better option here. So that is where the synergy is started to come in now. I did take some time, where we have a lot of orthopedic referrals as well. Patients coming to us directly from the orthopedic clinics. So that has been one of the accomplishments, I could say, that we've been able to get the message across to the fraternity as well.
So with some of these accomplishments that you're talking of, Dr. Basya, how have these furthered your vision for the future of pain management clinics?
Yes. So, like I said, in the beginning itself, for me, when I saw chronic pain, sir, I saw a problem that lies in every household. One out of every household, one member in every household is suffering with chronic pain at any point of time. So the problem was very clear to me that this is a big problem, and it is an ever-growing problem, because with advances in medical field and the aging also, aging population increasing, chronic pain is going to be there, that's for sure. And now even with the current lifestyle, even younger people are suffering quite a bit with chronic pain as well. So that was the main thing, that opportunity that I thought is there in solving this big problem, that led to our efforts.
Dr. Basya, now, what happens is that when a healthcare center is opened, a clinic is opened, an institution is started, the founder, who is a doctor, gets torn between doing medical practice for which he's been trained, and then he also has the responsibility of running that center in a sustainable manner, so that you are generating revenues. It is generating enough to put in the right infrastructure, to put in the right team in place. How do you manage, or how do you balance between your role as a doctor versus your role as a business leader of this institution?
So putting it simply, I would say that as you've been an entrepreneur for all your life, I could tell from your story, right now it is long working hours and days that involve the days in clinical work, early mornings. I put out towards non-clinical works and meetings, and follow the days followed by our patient interaction, patient treatments. And then in the evening, again, we get together to review our systems and processes, and how we can, and also look at other marketing avenues. So I would say it does, obviously, because as we are a growing organization, it involves a lot of concentrated effort from the core team, putting in long hours to be able to build this vision together. But obviously, this process is now we've been building a strong foundation from where in Bangalore, I can say that we have established kind of authority in pain management, and it has taken through our experiences, all kinds of experiences. We have now been able to get that awareness quotient up. So now it is about taking it to other cities across the length and breadth as well.
And Dr. Basia, since you're talking of the business of pain management, what happens is that running a center where you are based yourself as a doctor is relatively easy than managing a remote center, right?
Yes,
Or
sir.
centers beyond the geography. Now, how do you market your uh, business in a manner that people find confidence in what Alleviate does and come to these centers beyond where you work? I mean, I know you have centers in Amritsar and other places. How do you manage to market these centers?
Right, sir. So we've also started developing from the second year onward. We had our training programs in place. So we have proper fellowship programs of different durations where we've had national and international fellows come in for training in pain management. So that's where a pipeline also we are generating to see and meet like-minded people on the same wavelength who want to contribute to chronic pain and build a team from there. That is one of the things. And as we are growing, honestly, in the country, the specialty is also booming. So 5 saal pehle, 5 years back, there were handful of pain physicians per city. Now there are quite a few pain physicians, people jumping into this, thinking now, thinking about this as a complete full-time career option. The biggest challenge was before people were doing their other specialities and also doing pain, especially in anesthesiologists. They would be working as anesthesiologists for the full entire day and then come to their evening clinics or practices to see a few patients of chronic pain. So we were very clear. We want people who want to jump completely onto this side and want to devote their complete time to this. Only then, sir, it honestly works, because when I even started off before starting Alleviate, I met a lot of pain practitioners in India who'd been doing this for the last 20, 30 years also. And to be honest, I still didn't get a lot of confidence from them. They were like, this vision seems very big, grand. How are you going to work it out? How are you going to convince these people to come and work, leave their anesthesia practice? What would the economics be? So I understood that if the people who've been in this this specialty for so long, still they have their apprehensions about so many things. So the challenge, that's why I wanted people to be completely devoted to the cause. So I didn't want part-timers or freelancers doing this.
No, this is very interesting. You said, initially there weren't too many people willing to take this as a full-time career option. So now that has changed. People are willing to take a step to make this a career choice. And also, you said that, more and more pain clinics are coming up now, compared to what we've seen in the past. Now, if that is to be true, what also then comes up as a part and parcel of this industry is the competition. So how do you differentiate yourself from what you do at Alleviate from what anybody else does in the same expertise?
Yes, sir. So I would like to answer that by saying that two things have been very, very core to our practice. This comes a lot from my experience in the UK working there. The two things is, one is a patient-centric approach, and the second thing is a multidisciplinary approach towards chronic pain. So a patient-centric approach that we've tried to imbibe into our clinics is where patients' time is valued, plus the consultations are not hurried, where doctors spend a lot of time in consultation, which your first consultation is anything between, say, 40 minutes to an hour also at times, where we go through a detailed history. We do the imaging as well. Ultrasound is also there in the clinic, which helps us to have a good visualization of certain pathologies. Then so along with this, the multidisciplinary approach that comes in. For example, sir, if there is a 63-year-old gentleman who is suffering with arthritis of the knees. Now, he's generally fit in. He's fit in well without much comorbidities, but I mean borderline diabetes, but obesity is a problem. So he's on the heavier side because of gaining weight over the years. The quality of life has decreased, and the person is not able to enjoy life and is low. So there are many problems in this. So it's not that he has only knee arthritis. So this is the multidisciplinary approach where we tell the patients that it's not going to be magical doing any of these image guided treatments or even undergoing surgery if you are not willing to put in the work. So what we then do is we suppose if we have planned for regenerative injection treatments for the gentleman, which would be sometimes platelet rich plasma, stem cells, and prolotherapy. Along with that we would combine strict clinical nutrition strategy as well, where she would be having her consultations and getting him onto a diet plan. And we would have weight targets as well for 3 months, 6 months, 9 months from initiating the procedure. Then we also have a clinical psychologist, a pain psychologist, who would sit down with the patient, have some sessions, and understand how much this chronic pain has started affecting the quality of the life of the individual. And uplifting the mental health also becomes very important when we are treating something like chronic pain, because chronic pain is a difficult entity to treat at times because it is subjective. Sometimes the same amount of pain, one person would be saying that mujhe to kuch dard nahi hai, hardly, I'm pretty much okay, and the other person would be saying that I can't do anything, my life is ruined. So you can see, so there's a lot of reassurance plus lot of counseling and uplifting of the mental health, boosting the mental health is also important. So plus, and the other thing is physical therapy. We are very big on the physical therapy aspect of it. All our centers are integrated with their own physical therapy departments, where we after the procedures or even without the procedure, sometimes we take the patient directly through a structured physical therapy program. So they need to build their muscle strength and overall strength to be able to have the best results from whatever we are doing. So this is what we've been trying to do, sir.
Dr. Vasya, you brought up a very interesting aspect. You said that it is very difficult to understand, it's very relative, to understand how much pain the person is going through. Somebody could be facing less pain but shouts about it, and somebody else is able to bear a lot of pain, right? I understand, I have visited a few centers where you in the physiotherapy or the therapy equipment, there is a way to measure through technology that how much pressure the person is putting in, right? Similarly, is the technology advanced to a point where we could understand and measure to create some metric of understanding how much pain is there?
So since the last, say, couple of decades, we've been using pain score questionnaires. So these are pretty big in chronic pain management, because all our patients are given a questionnaire where we see where they are having pain in what activities, what aggravates the pain, what relieves the pain. So we get a measure of the overall pain index of a person through these questionnaires. And definitely there's some work going on in terms of technological advancements also in there, where pain mapping is coming up, where you could but still these are things in the pipeline. Even they've not yet been established modalities. As of now, it is more of history taking questionnaires, but those are things definitely that are in the pipeline and might come into the main foray as well, with AI especially.
So, who are your patients? Are
Yes,
these the cancer patients who walk into your clinic who want to manage their pain during their journey? Or are these people who have a chronic back pain or something? How do you manage individual interventions and individualized care for patients with different complaints?
right, sir. So, like I was emphasizing, so there is a lot of musculoskeletal patients that come into our clinics. People suffering with knee pain, back pain, neck pain, ankle, shoulder, and myofascial pains, conditions such as fibromyalgia, and these things are also pretty prevalent. So they form, say, 70% of our patients, and the next less 10%, 15% is with other conditions such as cancer pains or specific neuralgias or nerve entrapments that we treat. So there is a big chunk of these people who are now coming also from younger age groups, Before it was that only the more elderly formed the chronic pain spectrum, but now because of the current lifestyles and the stresses of the current lifestyle and today's active and busy life, people are sometimes in very, I would say, sedentary jobs, sitting in front of a system for a long time. They are also developing this chronic pain at a very early age. A lot of people in their 30s and 40s also now showing up at our clinics. Then sports injuries is also something that we focus on. So sports injury and sports injuries is, a lot of people think that sports injuries are only for sportsmen, but majority of sports injuries are to, I mean, non-sports people who are like, weekend players and doing it as a recreational thing.
And how many patients get treated through therapies compared to the ones who may need what do you call medical interventions?
So as in, we have interventions like suppose patients come to us and their problem is not very chronic. If they are suffering only for a few months or a few days or weeks with something, then the approach would be more conservative, not interventional. Then it would be more on physical therapy and medical management to see where we get from there. Suppose if someone is suffering with something that has become chronic now, and it is not responded well to conservative means, in a step ladder approach we follow, the next thing comes interventional management of the same, which includes interventional pain management procedures, regenerative medicine procedures, and so on, along with the definitely other specialties, multidisciplinary approach as well. So
Dr. Basia, also, tell me, we were talking of technology some time back. How are you at Alleviate leveraging the use of technology for diagnosing and treatment of pain conditions?
Right. So sir, I would like to say that when you, when you spoke about content, I was very intrigued because content is something that I've been very personally, very focused on building good content for our patients, for readers. So we've utilized at least a lot of media platforms in terms of, I actively blog. Almost every day I write 2 blogs about spreading education about pain management. Plus, then there is other media, social media platforms where we create awareness content about the conditions and the treatments that we do. So my idea has been very much inspired, like you said, a little bit from the WebMDs and the Mayo Clinics of the world, where I also want to make an encyclopedia of pain through this Alleviate. So this is something that has been there, been doing this for the last year. I have started focusing on this as well. So I want to make as much information available to people as possible so that, like all their common questions that they ask Google get answered, and they have at least, they have a good information available to them so that they can make informed choices. So that's where I would say currently the technology part or the digital part we are into. But going forward, definitely we're looking at making patient-centric apps where it will be very easy for them to assess something like their pain score, daily updates on the pain score, or weekly or monthly, seeing how they are improving, keep a track of if they're going down, what is the time, what were they doing that has led to increase of pain, and things like that, and see how they are improving, and maybe incorporate physical therapy also into the app. So this is something into the future. Obviously, this would be the second phase of growth, sir, that we are looking in, but that's where we stand now.
And Dr. Basia, since you're speaking about future, what do you see is the future of pain management practice in India? How big is the problem that you're solving, and what could be the size of pain management part of the healthcare industry? What are we looking at in terms of numbers?
Right, sir. So, like I said, so I'll try to give a perspective on this with Alleviate's role also that I envision in the field of pain management. So, like I said, when there is a problem that is as prevalent as 1 person in every household, जब हर घर में chronic pain है, so then that is a problem that is worthy of having a solution to that or a targeted approach to that. So I believe that there is a very big scope of this in terms of the number of patients who can be treated, and the number of treatments that can be offered to people. So, and also, like I said, this is an ever growing problem, which is it is something that has grown over the last 2-3 decades, majorly, that we can see. And so what I see with Alleviate, like I said, sir, like, so in the past 4 years, I can say that we have been the fastest growing chain of pain management clinics. I can proudly say that in the country, in terms of centers and in terms of geographies and the people that we have been able to service. So we want to create a system, centralized system, where there is the training of doctors, all the people who are at Alleviated, different centers across different cities. That's how we plan to expand into, have a common treatment protocol for that, and do the indicated things. People who are indicated for surgeries have to be directed towards that. People who want to get into who want to undergo any of these procedures, do that. Also, another thing, sir, another big thing, I actually roadblock that we had in the beginning also was insurance. So because insurance coverage is something which has been relatively gray area in pain management. Some people do understand the importance of pain management, certain insurance houses, certain corporate insurances, but still there is a long way to go. So that is also one of the challenges we are trying to come across with publishing a lot of content, or not content, sorry, a lot of work that we do in terms of our patients and all. So by now, sir, we've treated thousands of patients, and we're in the process of publishing articles on the same. So there's a lot of scope in terms of the literature also getting to the people and the fraternity.
Tell me one thing, Dr. Bastia, when we are talking of such a big issue, which is insurance, because most of your procedures would be daycare procedures. Now, keeping that in mind, do you work along in collaboration with other healthcare institutions, hospitals, for comprehensive patient care as well as coverage of insurance?
Right. So coverage of insurance. So we have one of our centers. We have an inpatient facility where sometimes patients come from, and it's an NABH accredited facility. So patients come in sometimes, and they are sometimes they are here. They travel from far away. Sometimes from different cities they come. They are here under observation also. And we're trying to facilitate. I mean, some are daycare procedures. We apply for the for the daycare procedure section, for their insurances, whatever there. But I mean, so the challenge has been that even now, when they sometimes send queries and we answer, then they understand what we are doing. I mean, as in terms of the treatment. So that awareness in that sector was also less, which is slowly building up on now. So more insurances are definitely coming into the play in this.
And one more business question, Dr. Bastia,
Yes.
that in today's date of competition, just creating content and sharing awareness is one thing. How do you get patients to know about Alleviate and create footfalls in your institute? Are you working with what is working for you? Is it Google AdWords? Is it things like Practo, etc.? How are you using digital technologies to get patients?
So I think it's a combination of all. It's a combination of all these things that play. So we've been very focused on improving our digital footprint in terms of increasing our SEO channels, our website traffic, and seeing and using these metrics regularly on a weekly and monthly basis. So, and that has been, and we've also done some direct media awareness programs to let the people know about what treatments we do. And finally, sir, end of the day, also the best publicity, that is the patients who get treated over here. When they go and spread the word to the society, that has a different charm of its, absolutely. So, but coming to the digital thing, we have our own YouTube channel, we have our own Instagram channel, and where almost every week we are constantly putting out new content about things, about awareness, as well as things we do. Sometimes we let the people know about the procedures that we are doing, so that they know, when they see that, they can say, okay, I have this problem, this could be a solution for me. So that is the kind of thing, that so slowly, I think, sir, everything is trickling in, and we get patients from Google, from Facebook, from Insta, as well as from direct media as well, along with the other patient reference.
Right. So Dr. Basia, my last question to you is about the future of Alleviate. What is your vision for Alleviate in the near future?
Yes, sir. So my vision for Alleviate is in the near future is to be in all the major cities of the country, and to scale our operations, get like-minded people, get doctors who are dedicated to the cause of chronic pain, who have very important factors. For the people I want to work with, I want to develop a team who start with empathy. So every member at Alleviate, one thing that we want to absolutely imbibe in their core, our core culture, is empathy towards patient suffering. So once that is there, plus if we have a like-minded approach, we are trying to find people, with whom we can work together and grow into other cities. And to be very honest, the thing that will escalate all this, will accelerate our process, is getting institutional investors in. So this is something that we are looking in, because now, as I had emphasized, the proof of concept we have had in Bangalore with operating a chain here. Now it is, we know how it works, how chronic pain works, and how to better the system to help people with chronic pain. The next challenge for us is to replicate this in other cities as well, for which we would need definitely some outside investment as well.
Awesome. Dr. Bastia, it's been such a pleasure talking to you. I love the futuristic approach that you have while you're setting up Alleviate and growing it as organized pain management practice. And it's a very magnanimous vision that you have. Second is, I love the patient-centric approach where you spoke about that, you are spending a lot of time with the patient, because that's the biggest challenge that the patients say that they face is that doctor time nahi lagata hamare sath, hamari baat nahi sunta. So that's a problem that you're solving at Alleviate. And third is, I love your vision of creating an encyclopedia of pain, sharing information. It's I think a very pain management is still in a very nascent stage. While you said there have been people who've been practicing for 20 years, but we haven't heard of pain management as a specialization until very recently. So I'm so glad that we had this conversation. Thank you so much for taking our time, and all the best for what you're doing at Alleviate.
Thank you so much, sir. Pleasure is all mine, sir. It's been an honor talking to you. Considering the things that you have achieved and what you have set out to, you're also definitely an inspiration to young people like us, I must say, sir.
Nice. Thank you so much. You've been very kind.